My name is Samuel Kenneth Stephenson. From a bit of all over. I grew up East Coast, moved to England for schooling, then briefly California, Boston, Los Angeles, and now Texas. There's a huge plethora of specialists that I work with on a daily basis. Medicine docs, general trauma surgeons, we have a team of PAs. So I'm an orthopedic trauma surgeon. So that is the fixing of bones. So if you're in a car crash, you'll come into the emergency department and the general trauma surgeons will see you. If there's anything wrong with your chest or in your organs, they'll treat that. But then if you have a broken bone, they call me. When I come and see patients, they can't walk or they've got a broken arm, they can't use it. The next day, they typically have a functional extremity. Oftentimes, when a patient has an infection, like an infected joint or an infected fracture, their primary surgeon doesn't want to deal with it anymore because the problem is too complicated. So the main problem with these people, I think, is finding someone who's willing to treat them. So those are the patients that I want to reach out to. I like getting that feeling of satisfaction. You know that what you did helped, and typically people appreciate it when you give them their mobility back, and so you get that feeling of appreciation too.